I want you to come take a look because my client, I've actually marked out where she has deeper scars, and her and I went through it together, the difference between one side versus the other. We're using Bellafill right now before we do some deeper subcision and laser. We did one treatment already, improved. What happens in some of the scars is they'll flatten, and when they raise up, instead of being like circular, they become broad. So it actually appears like they're a little bit worse sometimes at the beginning. And I always tell people, like, have a little patience, because not only does collagen production take time, but also once the scars sort of flatten, I just need another needle. Require to get it to even out. So we're at a better point actually with her. And what I'm doing right now is I'm going really superficial in the skin and doing some needle subcision to fill this with Bellafill. Remember, I lecture about this a lot. I teach about Bellafill. This is PMMA. We call it the spider web filler because it literally goes right under the surface of the skin. You guys could see I'm like literally just chopping through the scars here, and it helps form collagen underneath. And so my goal is just get that elevated. Now I'm going to switch sides. And then what we're going to do is we're going to laser much more strongly in that area as well. Ready? Come on over here. Grab that. And it's important, I think, for people to know scarring takes like not only a number of treatments, but also a combination of things. Her scars, like if you look at the rest of the texture of her skin, it looks unbelievable after the first lasering and after her sort of skincare, following a skincare and peels. But what we're doing lasers, even old use Juvederm or hyaluronic, and it improves for a short term building collagen, but it doesn't help lift the scars permanently, which is why we're doing the Bellafill. And what I like to do with the Bellafill is go more superficial, get onto the skin. It hurts a little. I always feel bad. I apologize. But we got to get scars lifted, and we're going to do perfect. Okay, hold there. Bigger treatment in 2 to 3 months. Maintenance from there. We may, at that point, or we may not need subcision. We may only need a little filler and not subcision. So we'll see how much it improves. You can see we're really lifting those scars. And again, PMA is a permanent filler, so it's very important you go to someone who knows what they're doing. We're injecting this for scarring, which is extremely different. And then go ahead and wipe that. It's extremely different the way we inject it versus so we're going really superficial areas. We already looked at certain lighting. Next step, process lifting and lasering.